most of the work on shielding was done manually and with a huge amount of time spent by two of our clinicians, June, one of our NPs, and Megan, one of our paramedics. So the question I have really, which is a question a lot of people have, is Eclipse has come onto the scene fairly late. Has it been useful, and what's the point?
Exactly. Has it been useful?
I think it has been useful in terms of giving us just raw data about who is high risk and who is not. However, we have found some flaws.
Some of the issues we had initially was the lack of the data being imported across to the COVID module. But the interesting thing was reviewing the patients. A lot of patients had received government letters saying that they needed to be shielding, and when we actually looked at them, they didn't need to be shielding. And a good example is those with sickle cell trait or carriers were all told to shield, whereas the guidance is that they don't need to be shielding. It's only those that actually have sickle cell and have had crises need to shield.
So if we had had Eclipse earlier, would it have saved a lot of time?
It would have saved a significant amount of time in actually identifying the patients that should have received a letter, just because it breaks it down into each individual category for you in terms of their WHO score or what they're supposed to be shielding for, such as immunosuppressant therapy or severe COPD. But I believe there was still a lot of hard slog behind it in terms of going through each patient and actually checking whether they do fit into those criterias, and having those discussions with patients that think they may and may not, and explaining the reasons why.
So what about practices that haven't started to use Eclipse yet? Is there any point in going through the lists again, and will it save them time going through the lists?
I think so, because even with once the data was imported over, we were still finding patients that we felt as a practice that were high risk, that should be shielding, that hadn't had any information, purely because of the information not being put into the records. For example, the rheumatology, dermatology patients who were on immunosuppressants that we hadn't been told about. It wasn't always picked up by Eclipse, but by picking up the fact that they'd got the drug, we were able to do extra searches. We went about it the long-winded way because we didn't have the data, but now when we look at it, we can look at them really easily and quickly and work out with a quick glance at records now if a patient should be shielding or not shielding, and giving them the right advice.
Yeah, and on that now we can see that patients have been contacted, and now our lists are up to date with Eclipse's data. We can see that there's only one or two that haven't been contacted, and actually get around to contacting them. It just makes it easier to identify patients that are coming to light or have evolving conditions.
One of the problems, I think, was that there was an information governance issue, which meant that Suffolk CCG couldn't send the information to Eclipse and upload it. That has introduced a significant delay. But now that that information is on there, as who's received a HM government letter, and then subsequently we added those that we had contacted separately with a COVID Protect letter.
Either by letter or telephone call, but interestingly, some of the patients that were recorded from the government letter from March, a couple of those that we've contacted and our social prescribers contacted to advise them they don't need to shield. They're quite relieved that they don't have to shield, that they just have to be strict in their social distancing. So that's given them a bit of relief, because to be told you've got to stay in for 12 weeks when you didn't really need to isn't very fair on some of these patients.
Okay, great. Anything else that you want to add?
No, I think it's just important that that Eclipse has been very good, but Eclipse has missed a few of our patients off that we've luckily found by doing a high read code search on them, and it's very interesting to actually put those two Excel spreadsheets together to identify those that weren't contacted on Eclipse, and now we can add them onto Eclipse, which is been helpful.
Okay, so perhaps two things worth pointing out, that the patient or the PAT list on Eclipse, it won't include those patients who have opted out of the
Summary care record.
Yes,
summary care
yeah.
record. And
But we didn't
therefore-
find many of those.
No.
We didn't have many,
No.
did we?
And the second thing is that the important thing about running the COVID-19 list is, of course, you can identify your patients very quickly because it includes their demographic information, including their names and addresses and things like that, whereas the PAT list didn't and wasn't allowed to.
No, and it was a long time to actually figure out a formula to put the PAT list and the reference numbers together to save a lot of time. Otherwise, we were having to search it manually.
Okay, so the COVID-19 list has been very useful in that
Yeah.
way. Great, well, thank you very much.
You're welcome.